Welcome to Straight Talk. I'm Eugene Chan. Professor Bian Zhaoxiang, Chief Executive of our first Chinese medicine hospital, is with us this evening. He's also Chair Professor of the Chinese Medicine and also the Associate Vice President of the Hong Kong Baptist University. With degrees from Nanjing and Beijing University, Professor Bian is a leading expert in clinical studies of Chinese medicine. He has published extensively, holds numerous patents, and has been a key figure in advancing evidence-based Chinese medicine in Hong Kong and internationally. Thank you for joining us for the first time, Professor Bian.
Thank you, Dr. Chan.
As we all know, Chinese medicine has long been a part of a Hong Kong healthcare landscape for many years. And as we said earlier, with the opening of our first Chinese medicine hospital just in the last December, it really is a turning point for Chinese medicine development in Hong Kong. But before we talk about this, how we integrate Chinese and modern medicine, maybe you can tell the viewers what is the current landscape of Chinese medicine in Hong Kong throughout your 20-odd years in Hong Kong. Have you seen Chinese medicine being more and more popular, or you have seen sort of even more younger people attend your clinics, or what are your observations?
Yeah, you are very correct. In fact, starting from the setup of the first Chinese medicine hospital, which is a milestone of Chinese medicine development in Hong Kong, more and more young people to see the Chinese medicine and get the service from Chinese medicine. In fact, that's milestone in many aspects. The first one is the first of the Chinese medicine hospital which can provide. Previously, we have the outpatient, but from the start from the Chinese medicine hospital, we always have the day ward service and also the inpatient service, which is milestones.
Right.
Secondly, the Chinese medicine hospital also is a teaching platform for the three universities, including Baptist University, Chinese University, and the Hong Kong universities of the Chinese medicine degree students. They can do the practicum at the hospital, so we have the collaboration with three universities. And the third one I think is very important is they have the research platforms to the more extensive deep researches, not just clinically and clinical based of the basic science of the research for Chinese medicine. So either from the clinical service or from teaching and research aspects, which is a milestone for Hong Kong's Chinese medicine development.
Right, Professor Bian, I must admit, being a dental professional myself, and also among many of the healthcare colleagues, we often see, of course, it may not be the full picture, we often see Chinese medicine as an adjunct, as a complement work for the Western medicine. That's the belief that we have. Is that true, or have we got it, not see the full picture? What do you think?
I think that you are correct to some extent. The Chinese medicine is an adjunct therapy for some certain disease. In the Chinese medicine hospital, we're providing the three types of the major service models. First one is a pure Chinese medicine, which is those type of disease can be diagnosed and treated with Chinese medicine, which is a pure Chinese medicine service model. Another one is integrated with Western medicine. Sometimes they have the Chinese medicine diagnosis and treatment plus the Western diagnosis, or Western diagnosis plus Western treatment. Like, give you an example, like the high blood pressure or the stroke problems. The patient normally have some of the diabetes or high blood pressure, but that times also have some of the movement problems. They're taking Chinese medicine and with acupuncture treatment, but they still have some of the treatment from the Western pills to control the blood pressure or diabetes. Yeah, that's the integration of the models. So those type of is another way, and also the Chinese medicine is good too for the prevention of the treatment. Yeah, not necessarily they have some significant disease condition, but they still have not very healthy conditions. They have the prevention. Yeah.
Right. So I think what you're saying to me is that actually, if we have the full picture now, that there are a lot of diseases that can be led by the Chinese medical colleagues,
Yeah.
and then have adjunct treatment from the Western medicine,
Yeah.
rather than what we always think that is only one way round. Am
Yeah.
I correct?
You're correct.
Right. So with the new hospital, I've just talked to your colleague, and she said to me that it's full house since it's opening.
Yeah.
Many young people coming through. Do they come in to see you as the main form of treatment, or still as sort of complementary to the Western medicine? What have you observed so far?
We have the two many types. The first one, for the outpatients, many of the patients coming to see the Chinese medicine treatment is we call it a pure Chinese medicine services.
Mm-hmm.
But still have the large type, some of the integration model, either in outpatient clinic or in our day ward.
Right.
Because at this moment we have outpatient and a day ward service. At the end of this year, we will have the inpatient services. We can find some of the type of the disease conditions which need to be treated both from the Chinese and Western medicine side. So we're promoting the integrative model, which is Chinese medicine and Western medicine, like Western physicians, like physiotherapy, like those of the radiologists. They're working together to provide service for the patients. That's give the patients a very good choice for that. Yeah.
So, Professor, I think one point I picked up after learning from you is that there are some diseases that will be best treated led by the Chinese medicine expert, then maybe supplementary by the Western treatment as well. Would that be more on the chronic illnesses, or what will be, maybe you can tell the viewers, what will be the from your opinion, the type of diseases best treated or best led by the Chinese medical practitioners?
Let's see, one type of disease maybe as an example for eczema. Eczema, which is very common in Hong Kong. And the patients suffer from the eczema is very painful for that ones. So eczema is normally they're treating with the Chinese medicine in decoction base or in plaster, comply with plaster, have very good effects.
Right.
That's one type of the disease of the treating with a pure Chinese medicine. Some other types like the functional gastrointestinal disease, some dyspepsia, those are functional diarrhea, those are type of conditions, or menopause, which is very common and treated with Chinese medicines.
One area I must ask you on behalf of the viewers are pain management, because I realize a lot of people will have pain sort of at different areas.
Yeah.
So will the hospital be a good place to look at this as well?
Pain management is one of the focus of the hospital. We have the 24 specific disease, which is our focus.
Right.
Pain management definitely is the one. You know, the pain management in the Western medicine side normally has some painkillers, those of the taking many of the painkillers and causing some of the side effects.
Right.
We found that in our outpatient clinic and also in the day patient clinics, those of the patients suffer from the pain symptoms. If they're treating with Chinese medicine, like the Chinese medicine decoctions, or doing the acupuncture treatment, or plus the massage or the moisture bathings, we have different type of the interventions for them. The results is good. Sometimes purely with acupuncture, moisture bathing is significantly reduced. There's a painkillers taken up.
Right.
Significantly reduce the dosage. Sometimes plus the acupuncture plus the physiotherapy have the better effects with a single treatment.
I see.
Yeah.
I must ask you one direct question, since this is Straight Talk. Cost is something that I'm sure many viewers are concerned.
Yeah.
Because with the advance of medicine, advance of our, even in our hospitals, especially private hospitals, there's always an escalating medical cost. How does Chinese sort of medicine treatment as compared to the Western medicine? Is it more affordable, or actually it's more expensive?
More affordable.
Right.
Yeah, because of the acupuncture treatment for those of the long-lasting pain symptoms is better. Yeah.
Okay. And also one area is talking about confidence in the profession. In medicine, we have the medical council. In my profession, you have the dental council. Also, you have nursing council, etc., etc. Do you have a regulatory body looking after the Chinese medicine right now?
Yeah, in Hong Kong, we have the Chinese Medicine Council.
Right.
Yeah, we take care of those of the registration, discipline, regulations, those are the stuffs. This is for all Chinese medicine and disciplines. And also in our hospital, we have the Chinese Medicine Hospital Board to governance all those of the hospital's operation.
Right, Professor, let's take a short break now. We'll be back with more Straight Talk. Welcome back to Straight Talk. Professor Bian Zhaoxiang, Chief Executive of our first Chinese Medicine Hospital, is giving us an update on Hong Kong's first Chinese Medicine Hospital and how this can be a competitive edge for our city. So, Professor, you have said to us that with the establishment of the hospital, you have been able to implement an integrated sort of Western and Chinese medicine model, a platform from research, and especially education for the 3 universities. Before we go any further, I'm sure the viewers are going to ask you a very direct question. Actually, when I was in the makeup room, I've asked my makeup artist, I said, how would you like to take your medicine? In pills or actually boiling the actual Chinese herbs to become soup or broth? There's a term for that. Maybe you can tell the viewer what it is. And which is better?
Traditionally, the patients take the decoction.
Decoction?
Yeah, decoction is faster and easier to take. And also, for new drug development, they still have other type of the like the granules. The granules, yes. Like the pills, which is based on the modern pharmaceutical productions. And those of the specific fixed type, like pills or granules, fitting for different type of the conditions. But decoctions, which is more easily to be specialized, personalized, individualized type. Right. So in other words, both have their values. Both have the values, definitely. Because I had the privilege to serve on Purifarm, a company before, and I learned more about the granules. And because it's standardized form, it's much easier for people to learn how to use them, and much easier for standardization. Because a lot of people say that sometimes, how do I know that the herbs are of a good quality? So how can you decide as a patient whether we should go for the traditional method or go for the modern method? For individualized treatment, especially for the common conditions for individual patient, maybe decoction is the best one. Don't worry about the quality. The Hong Kongs, they have the very stringent quality control from the raw material to the final products. Yeah. Right. Just now we talked about you have a Chinese Medical Council. Yeah. And then you talked to us about the cost. I'm sure there will be some complaints, right? Like the Hong Kong people are very stringent in terms of, I won't say demanding, but they want the best treatment for themselves. If there are complaints, what would be the most common complaints that you receive in your profession? I think that the hospital-wide, we have the system to deal with the complaints, different types of, like the clinical related or non-clinical related. We have the mechanism to deal with that one. Most common of the complaints they received, like the clinical side, I think that's one of the issues they concern about whether the treatment is, they can get the quick response for that one. So the doctors will explain to them. Maybe sometimes it will take times to get the response. This is one. For the non-clinical side, they always concern about whether they can quickly get the appointment, which is another issue. Yeah. I see. So basically, is with better communication. Better communication. I'm sure there will be much happier patient and doctor relationship. Yeah.
When you talk about Chinese medicine, I think in the past, before the hospital was set up, majority, when we go to see a Chinese medical practitioner, we go to the clinics. So now we have a hospital. What extra things we can do compared to things we can't do before? At least you have your inpatients, right?
Yeah.
What type of treatment or what type of diseases do you think you can treat now better than before? Because in the past, you have no clinics, right? You have only outpatient clinics, you don't have a hospital. What would be the diseases that you think is going to be better treated from now?
I think that the hospital bring back those very important breakthrough. I think that at least the three aspects. First aspect is about even in the clinical level, like the community still have the Chinese medicine clinic, but the hospital we have the clinic. The clinic deal with the primary care of the conditions. Comparing with community, the hospital levels primary care is more comprehensive because we have the Chinese medicine. In the hospital, we also have the Western medicine, we also have the lab testing, we have the X-ray, those of stuff. So we have the multiple teams for veterans. Also, the hospital provided a secondary and a tertiary service for the patients. That means regionally, in the outpatient clinic, we cannot treat it, but in the hospital, we have the day ward, we have the inpatient service, we can treat them intensively and with one stop. Give you an example like the post-stroke treatment. After acute stages the stroke, they still have suffer from many of the problems, like they cannot speak very well, they cannot swallow very well, they cannot movement very well. Those are the stuffs. In hospital, we can use acupuncture treatment, we can moxibustion, plus those of the physiotherapy, radiotherapy, those are the stuffs that working together. So providing more comprehensive treatment in one stop for them. So the hospital-wide, in the day ward, in inpatient service, can providing intensive, this is one. Another is multiple team treatment for the patients.
Right. So I think from what you're saying to me, I'm starting to see the greater picture of what Professor CMO is trying to do. That means the Hong Kong medical system is going to be even more comprehensive. Yeah. Because apart from our very high standard of hospitals and medical care, now we have the advancement of a Chinese medicine hospital. Would you agree?
Yeah, definitely advance the Chinese medicine service. Most beautiful part is that the Chinese medicine hospital providing a platform for not just the Chinese medicine and also communicate with the Western medicine side, like the physicians, like the physiotherapists, like the nurses can work in together. The first one is they have to communicate for the specific patient's clinical questions. That's the first one. Second one, they can find out for specific clinical question to deal with how to treat the patient very well, right. Which is a multiple teams model, which could be the core value for Hong Kong's integrative model.
Right. Professor, I think another area that we often talk on Straight Talk is the Greater Bay Area, which is very close to us. And as we would expect, there will be many Chinese medicine hospital already in the GBA. How does Hong Kong, so do we have a niche compared to the Chinese medicine hospital in the GBA? Or are we still more of the infant stage as compared to them? Where do we sit?
Definitely we are the new one because we just start the service around the half years. The GBA has many Chinese medicine hospitals, but the Hong Kong's Chinese medicine hospital still have the niche. The first one, we have the internationalization. We can go to the standardization for those of clinical protocols. Especially, we can have very good platform, integrate the Chinese and Western medicine in Hong Kong side because of the Hong Kong's different registration system is totally different from the mainland China. So that's a niche part. And also we going through the evidence-based approaches to promote the Chinese medicine practice.
Right, so if that's the case, can I say that Hong Kong becomes a bridge between Chinese medicine to the rest of the world?
I think the Chinese you are very correct. Chinese medicine hospital in Hong Kong could play an important role to promote the Chinese medicine to the world, because Chinese medicine in Hong Kong currently getting the strength for development, and also back with back support, very good support from the mainland China. And also you can find many clinical unmet needs, which is Chinese medicine can provide the help. So based on that direction, for those of the integrative model can better serve the patients.
Right, Professor, I'm going to ask you the last question of this evening. If you look at the question that I posed right at the beginning of the show, is how do we make Chinese medicine a true advantage for Hong Kong? What will have to happen in the next 10 years for Hong Kong so that this becomes a genuine advantage? What do you think?
I think that we can start from Chinese Medicine Hospital is exactly currently we are working on. Start from the one by one of the specific disease to developing those of the clinical protocol to help the patients, to treating them to get the effects more than 1+1. We wish that we can getting at least those of the effects for synergy effect for that one. Start from that part. We patient get the good effects, is more safety. We can promote those of the protocol, not just in Hong Kong's Chinese Medicine Hospital, around the Great Bay area, and we also wish those of protocol can go into the broad, go into the world. That's the way we think that we can promote the Chinese medicine from Hong Kong to the world, to let more patients get the benefit.
Well, Professor, thank you very much for sharing your insights with us. As we have heard, our first Chinese medicine hospital is more than just a healthcare facility. It marks a new chapter with new opportunities in healthcare, research and talent development, laying the groundwork for Chinese medicine to become a genuine advantage for Hong Kong. Have a good evening and see you next week.